Keep your baby healthy and your body happy during and after pregnancy. Assalamu alaikum and a very good afternoon. Ramadan Kareem to all of you. This is Dr. Asif from Prime Health presenting our first antenatal care for a healthy pregnancy and beyond live webinar session with all of you. The importance of antenatal care cannot be understated because it could detect abnormalities and preventable illness in mother and child both. Expectant parents who have questions surrounding pregnancy and parenthood should consider joining this session because of the health advice and guidance we'll be communicating to you today. With this, I would like to introduce our first speaker, Dr. Shamim Mir. Dr. Shamim Mir, I would like to introduce our first speaker for today, for this webinar session today. Dr. Shamim Mir is a specialist in obstetrics and gynecology at Prime Hospital with more than 35 years of experience. She has worked for more than 19 of these years in Latifa Hospital in Dubai as an acting consultant and has been an associate professor in India's reputed hospital. With her experience in managing complicated high-risk pregnancies, all gynecological cases, she's also an internal examiner and teaching for more than 20 years at Dubai Medical College. We welcome you, Dr. Shamim.
Good afternoon, everyone. And thank you, Dr. Asia, for your introduction. And I must say that I am here today for my dear patients whom I want to make aware about importance of antenatal care. Antenatal care is very important for 9 months taking the care of a mother and baby. And the antenatal is...
Thank you for that brief. I would like to introduce my second speaker, Dr. Rouba Specialist. She has over 20 years of experience in pediatrics and neonatology. She has worked in premier institutions in Syria. She was also an instructor in the neonatal resuscitation program and had participated as a lecturer in different national conferences. Also important to mention, she is one of the favorite doctors for many children. Welcome, Dr. Rouba.
Thank you very much for this sweet introduction. Today, I will try to highlight the most important and relevant point about baby newborn care and to give some tips to parents to help them go to this stage. Thank you very much.
Thank you, Doctor. I would like to introduce my third speaker for this webinar, Ms. Sakina, expert clinical dietitian with vast experience of more than 10 years in dietetics and nutrition, starting from pregnancy, lactation, nutritional management, or we must say medical nutritional therapy for diabetes, dyslipidemia, hypertension, thyroid diseases, and the list goes on. So with this, without wasting further time, I would like to request Dr. Shamim Mir to start with her presentation first. Thank you.
Pregnancy is not a disease. It's a physiological change in body. So we should not feel once we come to know that we are pregnant, there's something abnormal about us. It's just a change in the body. And what's most important is that the idea of having an antenatal care is that we should know the lady for 9 months, and our main aim is to have a healthy baby and healthy mother. With this antenatal care, we are able to detect that early any medical disorder or any problems with the pregnancy. We can detect it, we can diagnose it, and we can accordingly treat it. And we'll be able to know which are the patients which are high risk and which are the patients which are low risk. That doesn't mean any patient who goes routinely as with a low risk pregnancy, she can turn into high risk pregnancy at any time. Well, the most important thing is when the patient misses her period, she comes to you and we confirm the pregnancy. And it's very important for us to go into a detailed history of a patient because maybe she has got some medical disorders and she's already on having some medications, she's having some chronic illness, and we may need to change her medication. As we went to the history taking, one should not mind when we ask the patient about her family history, about her personal history, about her previous baby's histories, because this all is going to help us in the management of our patient. Now, what we do, the first booking which is done, that will be around 10 to 14 weeks. This is the time when we call it a booking appointment. And what are important things that we do at booking? History, as I mentioned earlier, then we do a hemoglobin, which is very important to know. And with that, we go for a blood sugar. It could be a random or a fasting blood sugar. We must do a urine test, because in pregnancy, there could be sometimes what we call as an asymptomatic bacteriuria. Patient may not have symptoms, but we should do a urine routine test for a patient who comes to us first time. Then blood group is also important. Whether if mother is RH negative, we need to know father's blood group as well. HIV is done as a routine test. Then VDRL, which is actually telling us whether there is any sexually transmitted disease. And if we find it to be positive, it needs to be treated. Of course, we'll be going for the further investigations. Then comes HBsAg, that is hepatitis test. This is also done as a routine for all the patients on booking. Now at 11 to 13 plus 5 days booking, when we do, there is one important scan, also known as an NT scan, which is nuclear translucency. This gives us an idea about if there is any suspicion of an Down syndrome. Well, this is done for everybody. It's not you get frightened, oh, why they are doing this test for me. This is a routine test done for all the patients as a screening test. And if we find any abnormality in that test, then we go for the further blood tests to confirm that whether really patient is having, and we have a blood test which can almost give us 99.5% accuracy. Now the visits, antenatal visits. We see the patient first time, we confirm her pregnancy, that thereafter from 10 weeks onwards till 28 weeks, we see patient at every 4 weeks. 28 to 36 weeks, it's every 2 weeks. 36 onwards, it's weekly, because there is a chance of developing some problems like high blood pressure, generalized swelling of a body, or any of these complaints. We call them more often after 36 weeks. Well, the diet will be discussed by my nutrition. She'll tell you in detail about the pregnancy diet. Then we come to our work and exercise. Well, there is nothing like if you are pregnant, you need to stop working. You can continue with your routine work. Of course, if it is a strenuous work, you can just what we call as a light duty. We can decrease our working hours if it is going to be very hectic for us. It depends how much you can. But normally work should not be stopped. I tell patients, keep on working till you go into labor. And to be honest with you, it has happened with me. I went into labor when I was seeing the patients, 19 patients I saw on the day, even when I went for my cesarean. So exercise, well, I must tell you that in Prime, we have an antenatal classes. And these antenatal classes were previously being held every month once in person. But unfortunately, due to COVID situation, now it's being done once in a month, but it's online. Now, the common symptoms, morning sickness, heartburn, low backache, increased frequency of urine, and vaginal discharge, these are the common mild symptoms which can happen in early pregnancy. Morning sickness is one of the good signs of pregnancy. But how to deal with it, again, my nutrition will be discussing in detail. But what I tell my patients is I tell them, vomit from here and eat from here. Never stop eating when you are having vomiting. Because if any person has a vomiting, we'll give them IV fluids, we'll tell them, don't eat something for 4 to 6 hours. But in pregnancy, you should keep on eating. If you stop eating, you will have more vomiting and you will get dehydrated. You may need more admissions to the hospital, and that won't be a very good idea. The best thing is Eat small meals and eat more frequently. Heartburn is again common. We can give mild antacids. Low back and constipations are related. Patient may have a mild backache. Doesn't mean we should go for a strong medications. We can just give them very simple mild paracetamol, which is safe in early pregnancy. At the same time, we have to deal with constipation. First with the food habits, and if that doesn't work, then we can give some mild laxatives. As far as the vaginal discharge is concerned, mild discharge will be there if there are no symptoms, if there is no itching. She doesn't need to change her panties every 3 to 4 hours, then we can leave it as it is. But if she is having itching and foul smelling discharge, then we need to take a swab, we need to see the patient, and we need to treat the condition. Hemorrhoids also may get aggravated during pregnancy. Hemorrhoids, what I mean by hemorrhoids is piles, which is a common term used by our patients. But again, for this also, we need to give them local application of some creams, but they should not think of getting operated because it will get much better after the delivery. Now, one more thing, sometimes patients come, they say they have bleeding from gums, sometimes they have bleeding from nose. This also, it is happening occasionally, one can ignore it. It can happen in pregnancy. But if it is happening on everyday basis, then you need to see doctor. Now, as I said, the medications, folic acid and vitamin D are the ones we usually give to a routine patient who has no complication in the first trimester. But the dose of vitamin D is much less than the one we give for a normal patient. Because we have seen in this part of the world, there is a lot of deficiency of vitamin D. And if patient is taking alcohol, this is the right time to motivate her to stop taking alcohol, because alcohol does have effect upon the baby and causes birth defects in baby. Smoking, telling the patient that you're going to have a small for baby will be affected, baby's growth won't be proper. I'm sure we motivate patients, they will get motivated to stop smoking. And I have seen patients who have stopped smoking and then even after lactation, they have not gone back to it. Now, travel. Normally, we allow patients to travel till 34 weeks of pregnancy. But the best is the mid-trimester. The first trimester, first 3 months and last 3 months, if we can avoid traveling, that is better. And in the first middle trimester, we can travel. But what the instructions we give to the patient is just try to walk, take a small walk after every 3 to 4 hours. And if it is by road journey, stop the car and just take it, because there's a tendency to develop venous thrombosis. And we should not allow the patients to travel who have complications like anemia, they have a history of bleeding, or they have a history of threatened preterm labor, and some other medical conditions where we should not allow them to travel during pregnancy. Now, this triple test marker, or this is performed for the patients whenever we have a suspicion of Down syndrome by our scan. We can go for this test, and we have one higher test than this one that's called NIPT, which is specific in almost 99.5%. It can tell us if patient has got Down syndrome. And there are further some confirmatory tests which we go ahead if we find the basic anti-scan is abnormal. Now, gestational diabetes. There's a screening test which we do around 24 to 28 weeks of pregnancy for all the patients. And because pregnancy itself, we call it the diabetogenic. There may not be any history of diabetes in family, but still patient can have diabetes for the first time in pregnancy. That's known as gestational diabetes. So we do a screening test, and if we find sugar levels are very high, we refer them to endocrinologist. But if they are borderline high, we can control them with diet and sometimes oral hypoglycemics and insulin if needed, if they are not controlled. But please, my dear patients, you must know that having a control of these blood sugars is till you deliver. Because there are patients who come and they say, now our sugars are fine. Do we need to follow diet? Yes. We need to follow diet till term, and after term, then you can take anything you would like to. There's a condition also known as pre-eclampsia. This usually we tell our patients, if you have swelling all over body, if you have headache, if you have epigastric pain, if you have vomiting sensation, especially around 28, after 28 weeks of gestation, you should report back to doctor, and we need to admit the patient and deal with the patient because she can, God forbid, have a fit. One more condition I heard about is placenta previa. Normally, placenta should be, there's a location for a placenta in a womb, it stays up. But when the placenta is down in the lower segment of the womb, in the lower part of the womb, there is a tendency to bleed. If such patients, we don't allow them to travel, we tell them to take more rest, and we deliver them at around 37 weeks by cesarean section. Now, any patient who comes to us for a routine checkup, we check blood pressure on each visit, we take their weight, we see their urine for albumin and sugar and other vital signs like temperature, which are not of that importance, but we do have these basic investigations to be done on each visit, and the clinician will see the patient, look for the growth of the baby, and as I mentioned earlier, the ultrasounds normally in any routine low-risk pregnancy, we do around 3 ultrasounds. That is one at between 11 to 13 plus 5 days. Then we do one more anomaly scan, which is done between around 19 to 21 weeks. And sometimes even at 22 weeks, we can do this anomaly scan if for some reason patient has come to us late to rule out there is no gross anomaly in the baby. And then one more growth scan, which we do anytime after 28 to 36 weeks. There is a one test which we do around 36 to 38 weeks. People do ask, why are we doing it? We do a swab test for GBS. GBS is one of the bacteria, I would say for you in a simple term, which can affect the baby. So we want to make sure that the root is clean, and if it is positive, then patients needs to have antibiotic during labor, not otherwise. With this, I've been asked to make my presentation as small as possible. So what we should not do is repeated weighing yourself every day, having pelvic examinations and breast examinations every time. No need to have vitamin A, or there is, if the patient is having a good nutrition, we may not even give her iron, and there is no need to have an ultrasound on each visit, and routine screening for preterm is not needed. And we should actually take a good diet. And if we have anything that we find is not normal in pregnancy, we should report to our OB/GYN doctor rather than ignoring and sitting, because the examination does make a lot of change and change your opinion, what you feel on the phone when the patient calls you. Now, what is the latest news that I'm going to give you? A good news is that now we are in COVID era. The COVID vaccination has been allowed by Joint Commission of Immunization, and in UK and US now they have, even in UAE recently, I think about a week back, I saw there is a circular saying that we can give COVID vaccination to all mothers who are pregnant. They are planning when they will give, but if a patient is planning to get pregnant, till yesterday, I was giving a certificate to patients saying that you will cannot take a vaccination because she's planning to have a baby. But now COVID vaccination can be given to patients who are planning to have baby, or who are already pregnant, or who get pregnant after vaccination. And same goes for lactation. There is no need to stop lactation, and you can take a COVID vaccination, but the timings they are going to set. And the same goes for our vaccination during pregnancy. And then there is a vaccination called by the name of Boostrix, which is for pertussis, diphtheria, and tetanus. This vaccination has been recently recommended and is being offered to patients between 28 to 32 weeks. But in UK, they have started giving it 16 weeks onwards, up to 32 weeks. This prevents and gives a passive immunity to the baby from not developing this disease. Then just a word about stem cell. Stem cell is we take a cord blood and this can be stored, umbilical cord blood, this can be stored for about 20 to 25 years, and it's supposed to be very good for genetic disease. And with that, I thank you all for listening to me. And if you have any questions and queries, you can just ask me at the end. I'm sure you will have lots of questions. Thank you so much.
Thank you, Dr. Shamim. It was really elaborative and quite enlightening. We have received a lot of appreciation in between for you. Many of the patients who know you, they are now adults as well, have appreciated the presentation, as well as you treating them as the treating physician. I would like now to request Dr. Rouba to start with her presentation as well. So as I mentioned, Dr. Rouba is one of the favorite pediatricians for most of the children because most of the children like to be with her, and they never feel any vaccination whenever she's around. So she's favorite for many kids. So I would now request Dr. Rouba to start with her presentation. Thank you.
Yes, thank you, Dr. Shamim, for this lovely lecture. Now it's our turn now. Baby is already delivered. And as a mother passes the experience of labor, also baby has to pass the critical time of fetal to neonatal transition time, where a lot of changes in their heart and lungs occurs. Majority of babies complete this process smoothly. Less will have little bit faster breathing and increased heart rate, fine crackles in their lungs, and the bluish discoloration in their hands and feet, which is normal. That all will settle fast. Less baby need extra investigation or intervention to stabilize, but it's very less. How to help your baby in this critical time? We have to keep your baby warm, and the best way is a skin-to-skin touch, where your baby bare skin should be on your chest after delivery. If mother cannot do for some reason, father can do. If not, then we can keep baby under warmer. But baby who experience the skin-to-skin touch are actually healthier and happier. Nurse will continue drying your baby from blood and fluid, but we'll try to keep the vernix, which is the cheesy white material, will help to keep your baby's skin intact and also maintain temperature. After that, we have to climb the umbilical cord within first and third minutes of life. Your pediatrician will assess your baby in the first and fifth minutes of life. We call it Apgar score. Usually it is more than 7 out of 10. Mother has to initiate breastfeeding. Nurse also will take care of baby eye by cleaning with the sterile water, or can use antibiotic ointment to prevent infection from birth canal. A shot of vitamin K given in the thigh to protect bleeding and help clotting. Meanwhile, the nurse will dress your baby appropriate clothing for ambient hair, swaddled and kept in mother room, but in a crib. We should delay bath after 24 hours to maintain baby temperature between 35.5 to 37.5. Meanwhile, baby has to pass 1 time urine and 1 time poop in the first day. That's why it's very critical. Keep the baby 24 hours at least in the hospital. Don't rush to go home because a few things can happen. That's why baby should be under observation. Some early tests and procedure we have to do: vaccination, BCG vaccine given in the upper left arm, and hepatitis B. Hearing test to detect any defect so we can save baby language, and congenital heart disease screening test. This is simple test. We can check the oxygen in 4 limbs. If baby did not pass, then we have to request echocardiography to exclude heart disease. Newborn screening test is usually done after 48 to 72 hours. A few blood from baby heel to detect the thyroid function of the baby and some inherited and metabolic disease. If we didn't detect early, it will affect baby growth and mental health. Also, we have to check jaundice level. We'll speak about this in a few minutes. And your baby will go home with vitamin D 400 international unit in a day. After discharge, your baby will be scheduled for postnatal visit 3 at day 3, between day 7 to 14, and at 4 to 6 weeks after birth. Of course, don't forget to prepare your car with a rear-facing car seat for baby safety transport. Frequent ask questions from mother we can see from our round, asking about baby head. Actually, all babies, they have soft area. We call them fontanelle in the front and back. They will close within a few months. That will help brain to grow. But we have to understand, when the baby is passing through the birth canal, skull bone will overlap, and that of course will affect baby shape, skull shape. It will be elongated or coning, and sometimes some soft area of fluid accumulation, we call that caput. All this will settle down. Some babies, they might have breast pud or swelling of genital area. This is due to hormonal effect. This is also transient. Female baby, they might have vaginal discharge or mild bleeding. We call it minor period at day 3 or 4 of life. This is also due to a hormonal effect. No need to worry. Baby really have a few rashes, which are concern for mother, but actually most of them are transient and no need to worry. Among of these is the Mongolian spot, which is a bluish discoloration on the back. This will take few years, but it is harmless. Now, how to take care of the umbilical cord? Actually, many mothers comes. This area is scary. I don't want to touch. I don't want to clean. No, you should be confident. It's not painful to clean. And you have to practice clean, dry care and avoid harmful traditional substance. We can use chlorhexidine 4% to the stamp. Please fold the diaper below the stamp. And if it got soiled with urine or stool, you can wash it with water. Give a sponge bath until cord stamp falls off and the navel is completely dry. And it is normal to see little blood when stamps fall off. Usually this happens between day 5 and 15. But please you should seek advice in case the cord becomes red or swollen, smells bad, oozes pus, or bleeds continuously. Breastfeeding, we all know that exclusive breastfeeding is the recommended one. That's why we need to initiate in the first or second hour of life. Please feed your baby your colostrum, as it is concentrated with the nutrient and immune factor. Feeding on demand, and you have to follow your baby feeding cue. When your baby open mouth, licking lips, or rooting, like turning head and open mouth, sucking on anything nearby. Don't wait till your baby cry and be stressed. Be sure that achieve good attachment and positioning. You have also to take good position with a lot of pillow surrounding you, holding your baby in your lap, supporting neck and back. Baby has to latch nipple and good portion of areola. Otherwise, your nipple will get sore. I'll give you one tip to help you with this, that you have to smear your nipple with the hind milk. That will reduce the incidence of sore nipple. Once the feeding is established, your baby will have wet diaper around 8 to 10 times in a day. Stool color will change from black, green to brown to yellow by day 4 to 5 of life. A stool of breastfeeding mother usually soft, seedy yellow, and several times in a day. And it's very important to follow the recommendation of safe sleep practice to prevent sudden infant death syndrome, we call it SEEDS. So the ABC of safe sleep is alone, baby on his own sleep surface, on his back, and bird crib. So always at the bedtime, at nap time, your baby should be on his back, on firm mattress with a tightly fitted sheet. Never use soft bedding, pillows, or sheep skins or fluffy toys. Baby should not sleep on adult beds, couch, or armchair. and never feel asleep in car seats as they cannot maintain their airway open. Your home should be also a safe environment. Never smoke around your baby. Keep room temperature, comfortable temperature. Don't overwarm your baby. Breastfeeding is a factor which prevents seeds. Pacifier use is also preventable, but please don't use it before the 1 month of age, and follow the proper recommendation, as you have to use a clean, dry pacifier. Don't force your baby to use it, and if it falls off, don't need to put it again in his mouth. And don't attach the pacifier to your baby clothes, or use a pacifier attached to stuffed animals. You can practice tummy time, but only when baby is awake and you are with them. Jaundice is one of frequent or common things which affect your baby. Actually, it is the yellowish skin and white of the eye, usually physiologic and harmless. Start at day 2 to 3 of life and clears up on its own by day 10 to 14. Very less cases, it is pathogenic, and your pediatrician will help you with that. How to deal with your baby once jaundice? We have to do frequent feeding every 8 to 12 hours. Be careful also that your baby, when gets jaundice, he will be lazy. So you have to wake your baby up every 2 hours. Sun exposure, 10 minutes twice in a day, but be careful also, baby should not get sunburn. Phototherapy, this is the blue light in certain waves. We might need this one if the bilirubin level went beyond certain limits if we compare it with baby age. Some babies are more prone to this treatment, like premature baby or those who has jaundice in the first 24 hours, or if there is family history that some baby needed phototherapy. Now, hiccups and vomiting, actually very common complaint. Baby swallow air while feeding or crying, and the sphincter between the esophagus and the stomach loose in this age. So that's why spitting up and dribbling milk with burp or after feeding is fairly common. But some baby may constantly spit up all or most of every feeding, or choke during feeding. And the esophagus can be irritated with stomach contact. We call this reflux. So check with your pediatrician. If your baby is vomiting forcefully, vomiting green bile or blood, or become lethargic or has any signs of distress. These some tips to help your baby if he has reflux. Be sure your baby's diaper is not too tight. Feed a smaller amount and more often. Burp your baby often during feeding. Handle him gently after feeding and hold in upright position for about 30 minutes after feeding. When to burp? Breastfeeding baby. You should burp them before switching breast, or if baby start pulling away from breast or become stiff, fussy while feeding. Plus, after when you finish nursing. For bottle feeding, these are applicable, only that you have to burp your baby every time they drink 2 to 3 ounces. And this is a burping position. You can see the first one is upright. You have to support baby head. The second one on your lap and the head little bit up. And the third one, sitting position. You have to support your baby chin, and you can tap on the back. And not all babies always burp. And infantile colic, actually, this is a common complaint when parents come to clinic visits. Infantile colic is fairly common. It affects 1 in 5 babies, regardless if they are breastfed or formula fed. It is episode of crying for more than 3 hours a day, for more than 3 days a week, for 3 weeks in an otherwise healthy baby. Often this happens in the evening, begins at 2nd week of life, peaks at 6 weeks, and resolves by 12 to 16 weeks. We don't know why this happens. Baby cries, draws knees up to his abdomen or arch his back when crying. So what we can do? We have to assure you, dear, that baby is well. There is no fault from your side, and this phase will pass within a few months. But we can soothe your baby by massage and warm bath. There is no proof in medication, but a trial of 1 week medication in case of parents are not coping with the case. We can try simicicone, lactase enzyme, diet modification, and hypoallergenic formula. Please bring your baby anytime to be checked. If he has jaundice to salt, difficulty breathing, temperature out of the normal range, poor response to stimulation, convulsion, and difficulty breathing. I wish you happy parenting and thank you for listening.
Thank you, Dr. Rouba. It was really insightful. Now, I would like Ms. Sakina to proceed with her presentation, but I must say, right from umbilical cord care, breastfeeding, warm care, even dads are responsible for that too. We have received a lot of appreciation for your presentation as well, and we're going to have this question answer session right after Ms. Sakina's presentation. So here you go with Ms. Sakina's presentation. Are you ready?
All right. Hi, good afternoon, everyone. Back to pregnancy. So I'm going to discuss pregnancy nutrition with you all. Now, right from the time you conceive, there are so many notions about right from the time we conceive, there are so many notions, what to eat and how much to eat, and your parents have some say, your relatives have some say, and there's so much on the internet. So there's a lot of confusion around it. So today we are going to discuss right about that. Now, important steps to a healthy pregnancy, of course, eating a balanced diet for good health and fetal growth, gaining proper weight, that's very important. Physical activity, as Dr. Shamim also mentioned, you shouldn't be stopping your regular work, and make sure that you are engaged in some sort of light physical activity. Taking your vitamin and mineral supplements, that's again very important to bridge the gap between your between your requirement and what you're taking. And there are certain things that you need to be avoiding. All right. Now, eating healthy in the right amounts can have wonderful effects on the prenatal development of the child. It's also very important for the brain development of the child. It's very important for healthy birth weight of the child. Also, with regards to the mother, it's important to prevent complications during pregnancy as well as during delivery. Also during pregnancy, things like nausea, vomiting, fatigue. It is important to have healthy foods to prevent these things, and as well as constipation. Okay. So we quickly brush through it. Nutrition needs during pregnancy. Definitely the needs increase because, there is developing organs such as uterus, placenta, breast tissues, and also to build up body reserves to be utilized at the time of lactation. Now, the first trimester, there's not any significant increase in the size of the fetus. So you don't need to increase the quantity of the food. You eat what you were eating during before pregnancy, but definitely you have to improve on the quality of your food. You have to start, making sure that you're eating a lot of healthy meals and avoiding unhealthy stuff. Second and the third trimester, the nutrition needs definitely go high. So in the first trimester, like I said, it stays as pre-pregnancy. In the second trimester, you need to increase your calories by 350, and by the third trimester, another additional 100 calories. Okay, and the protein will be increased by 15 grams. So just for an example, 350 calories is just half an avocado and 1 cup of cooked lentils. Okay, you don't need to eat for 2 people. 350 calories is just this. Now, I've given this example specifically because it's very important for you all to include a source of healthy fats when you're increasing your calories. So either you do avocado or you can take some other source, like you can do pistachios, you can do a handful of mixed nuts, you can do olive oil, and for the other half, you can take lentils, which is a protein-rich source, and a vegetarian source, a plant-based source, which is even more healthier. All right, so this meets your calories as well as the additional 15 grams of proteins that you require. Okay. Now, like I told you, all the calories that you consume during pregnancy should be coming from healthy calories. The quality of the food that you have is very, very important. All right. Now this is the healthy plate. This is how your plate should look like. Half your plate has to be fruits and vegetables. 1/4 should be your protein, because protein serves as the building blocks for the growth of the body. So additional 15 grams in the second trimester and 25 grams in the third trimester. 15 grams, like I told you, would be equivalent to a cup of cooked beans, or if you're having chicken or fish, it'd be between 50 to 75 grams of additional from the first trimester. Very important, your carbohydrates, the second half, 1/4 should be your carbs. 50 to 55% of your calories should come from carbohydrates, irrespective of whether you're overweight at the moment or you are, gaining weight very rapidly. You have to make sure that you're not going on a low carb diet during pregnancy. You have to make sure you're taking carbs from whole grains, high fiber carbs, but not going low carb, because glucose is very important for fetal brain development, and cutting down on carbs completely will cause neural tube defects in kids. So make sure that you're not cutting down on carbohydrates or going low carb during pregnancy. Also, exercise, your water intake, at least 10 glasses of water per day to ensure that you're well hydrated. It also helps with nausea, morning sickness during pregnancy. UTI, which is very, very common during pregnancy, it helps in uptaking your nutrients much better. Nutrient absorption is much better if you're well hydrated. So make sure that you are taking your 10 glasses of water every day. Okay. Nutrients during pregnancy, important nutrients that are required during pregnancy. Like I told you, multivitamin is very important if you feel that your diet is not adequate. Folate is needed to reduce the risk of neural tube defects. Either you take it in the multivitamin form, or you make sure that your diet is adequate in dark green leafy vegetables, fruits, fortified breads and cereals. Iron, which is again very important to reduce the risk of premature birth. You take it in the supplemental form, or you can take it from food sources. Like non-vegetarian sources are higher in iron compared to vegetarian sources. Calcium, again, fetal bone and teeth development. Omega-3 fatty acids, very important. It is seen that women who supplement during pregnancy give birth to infants with higher IQ scores and mental processing scores. So make sure that you are taking this, or you take 4 servings of fish per day, the ones that are low in mercury. Iodine, very important again, but use of iodized salt is sufficient to meet these requirements, and zinc. Okay, now there are certain foods that needs to be avoided during pregnancy. So these are them: raw or undercooked food, unpasteurized cheese, raw fish, and sushi foods, fishes that are high in mercury, contain raw salads from outside. So make sure you're not taking salads from countertops. Leftover foods that's kept at room temperature for more than 2 hours. Drinks to limit should be, of course, alcohol, unpasteurized milk and juices. Caffeine to restrict to about 200 mg. That's approximately 1 cup of coffee per day. Okay. Now, morning sickness, which is very common during pregnancy. So make sure that you're eating slowly. Have small, frequent meals every 2 to 3 hours. Drink a lot of water, like I mentioned before. Eat soft and easy to digest foods. Low-fat diet avoids oily or spicy foods, acidic foods. Avoid a lot of caffeine. Like I told you, restrict your caffeine to 200 mg per day. You can also consume a little bit of ginger or maybe ginger tea, boiled candies, or a few sips of Sprite that is, again, caffeine-free, so that it helps in preventing nausea and making sure that you don't, it helps stopping the vomiting as well. Also try to go for regular walks, especially after you finish your meal. This helps with indigestion as well as acidity. Constipation, which is again a very common problem during pregnancy. For constipation, there are 2 things. One is your fiber intake, one is your water intake. Water, 10 glasses a day should be taken, must. Fiber, make sure all your carbohydrates are whole grains, and you should be consuming half your meal for lunch as well as for dinner. Half your meal should come from vegetables. That will give you the much needed fiber to prevent constipation. And lastly, I would like to say, healthy eating for a child starts in the womb. So if you want your kids to grow up to be healthy eaters, make sure that you're eating healthy and having a variety of flavors to expose them to it so that they are not picky eaters, which is a big, big concern for every mother. Thank you. If we have any questions, we just take it up now.
Thank you so much to my all three speakers. It was really an excellent session for me also to understand and also to upgrade my knowledge on the same topics. Before presentation, we have received a lot of questions from our people who have registered for this webinar session. I would like to take this opportunity to ask Mr. Muhammad, probably he's an husband of a lady, is asking, this question is for Dr. Shamim. During pregnancy, why is the patient not advised to take double marker test along with NT scan instead of saying it's optional? So it's a kind of query Mr. Muhammad is asking.
Yeah. Can you hear me, Dr. Asia?
Yes, Dr. Shamim.
Yeah, the question is why we don't do as a routine double marker test. But we have not made it as a routine. If the patient wants to have it done, she can always request her OB/GYN doctor and get it done. Otherwise, we do as a screening test only NT, that's nuclear translucency. And as I mentioned earlier, if suspicion, then we go ahead with the other tests. And the specific is NIPT, which we do, which is 99.7% accurate. So his question is, why don't we do it as a routine? We have not been doing many tests as a routine, and it's a question of a cost factor as well, and sometimes it's not covered by the insurance. But if it is needed, we don't care for something is really needed to be done, we will do it. But normally this is not done as a routine.
Absolutely, doctor. And with this, I would like to tell my audience and Mr. Mohammed also stop trying to make Google as your doctors and listen to what doctor says, because most of the time our patients, approach Google and there it increases the confusion. The second question I would like to ask Dr. Rouba, the mother is asking, how do I get my baby to sleep through the night, and why can't I put, I can't get my baby to stop crying. So two questions at the same time by mother. How do I get my baby to sleep throughout the night, and I can't get my baby to stop crying? So both the questions.
Actually, yeah, thank you. Actually, baby will not have the schedule of the same parents, especially first 2 months. Baby has to feed frequently. So we cannot say about night sleep before 2 to 3 months. So demand feeding could be, as we said, every 2 to 3 hours. And we have to understand that very less baby who have direct long night sleep. But this is not the common things. Now, later we can organize our baby that we have to stick to a schedule every day, same time we have to go to bed with dim light and feed your baby, keep your baby in on bed. If baby cries like for 1 minute, this is not before 2 months or 3 months, then you can leave him to cry 2 minutes, then you can go and assure your baby. Never bring your baby to your bed. And crying is expected also in the first 3 months, especially due to colic, and something else we call it dysphagia. Well, the baby tried to pass stool, but he cannot because there is no correlation between the brain and the bowel. So he has to push from time to time, and he has to try to increase the pressure inside. That doesn't mean that he is in pain. You always have to carry your baby, soothe him, do baby massage.
Thank you, doctor, for that. Ms. Sakina, a question for you. How much caffeine consumption is allowed during pregnancy? As we know that we live in the country of coffee lovers. So kindly brief it so that we know that.
So like I told you, 200 mg of caffeine, that is approximately 1 cup of coffee. And if you are a tea lover, then you can go up to two teas per day.
Okay, I hope that cleared the answers for most of the audience. Dr. Shamim, some rapid questions I would like you to answer briefly. One of the patient has asked that Miss Nuran Khalid is asking, how many movements per day of the baby during 7 months is normal? Dr. Shamim, some rapid questions for you. How many movements per day of the baby?
10 movements in 12 hours is quite acceptable. It could be 3 movements in 1 hour, and next 1 hour there may not be any movement because baby does sleep for nearly 90 minutes. But in average, 10 movements.
Miss Maria is asking details of baby movements in 5th month during first pregnancy. I mean, this
well, 5th month, normally we really don't tell them to maintain their fetal movements because it's very, very early pregnancy, roughly around 20 weeks. But we do patients feel at around 18, 20 weeks, we call this fluttering. They just feel as if somebody is going to tap on their abdomen. But fetal movements are normally asked to keep count after 28 weeks, even after 24 weeks. If there are less fetal movements, patient can come to us. But normal record is after 28 weeks.
Very important question, Dr. Shamim, for you. How do I prepare to have natural delivery in the last trimester? Is asked by Ms. Kang.
Yeah, it's absolutely a very good question. But I would request whosoever is asked this question that to prepare for normal delivery is to go for walks. And we have a antenatal classes in our hospital online every month. We have it once in a month, so you can attend those classes because there are a number of exercises which are very mild ones, like on a ball and the other things which will be taught by our people. So you can register yourself. It's a free class.
Thank you, doctor, for that. Miss Nandini is asking, is adding 8 kg at 12 weeks is normal?
Well, there is nothing to really be worried about if she has put on 8 kgs at whatever gestation she mentioned. But if it is associated with generalized swelling and the blood pressure is also high, then she needs to really go and see a doctor. Otherwise, nowadays, weight gain or less weight gain doesn't affect the baby. We have to see the growth of the baby. It's not directly proportionate to the mother's weight.
Mr. Anis is asking on behalf of wife, how to tackle back and joint pains post-delivery?
Well, back and joint pains post-delivery, we must have a very good nutritious food, and we can add some calcium and vitamin D, which as mentioned earlier, deficiency is there. And the most important thing is, please keep a proper posture when you are feeding your baby. We forget as a mother, we give all positions to ourselves and feed our baby, and then we have a terrible backache. So take care of that and take some calcium and vitamin D.
Thank you, Dr. Shamim. I would like to proceed to Dr. Rouba for some rapid questions asked by our attendees. How many bowel movements are normal for babies?
Bowel?
How many bowel movements are normal for babies?
Yes. Actually, it's minimal 2 times in a day. It can reach 8 times in a day for breastfeeding mother. But maybe later, baby will pass every 2 to 3 days after 1 month once, which is acceptable, provided the stool is soft, not hard or bold. So there is range between 2 to 8 times in a day.
And is it normal that babies lose weight after birth? How much should it be?
Yes. Between 5 to 7% baby will lose weight, but from day 4 to 5 onwards, babies start to gain weight. So if we check baby weight by day 10, it should match birth weight.
For babies who are crying, one mother is asking, how do I know my baby is getting enough breast milk, and what is the time limit they should breastfeed from either of the breasts?
Yeah, breastfeeding should be 15 minutes each side. But of course, don't forget you have to burp your baby in between. Mother always are worried, is my milk is enough or not? Actually, some mother, they even tend to do breast pump to see. So when your baby is sucking nicely and sleep for 1 hour after feeding, this is a sign that he got some enough milk. Plus, we have to watch how many wet diapers in a day. And finally, checking baby weight. So if there is the wet diapers in the day and the baby is maintained his weight by day 7 to 10, then this is a reflection that breast milk is enough. But mother, if she's too much worried, she can pump her milk and see how much amount, because baby first day need between 30 to 60 ml per feed.
Absolutely, doctor. And we have a lot of women who are working mothers as well. And what is the advice for storage of breast milk for them?
Yes, of course, we encourage you to continue breastfeeding, and you need to, in ahead, pump your milk and keep it in a proper storage bag. And you have to write the date of this on the bag so you can consume this first. Generally, when you pump your milk, it will be okay for 4 hours in room temperature below 25. In the fridge, up to 4 days, but remember, back of the fridge, not on the fridge wall. In the freezer, up to 9 to 12 months if it is minus 18.
Thank you, doctor, for that. Now, very interesting question I have. If your baby hands feel cold, should you dress them in warmer clothes even in summers?
If your baby arms and feet are cold, you have to check also the center of the body, because you know baby's control of vessels are not still complete, so we can feel that baby arms and feet are warm. Sorry, cold, but the body is warm, so no need to cover. You can cover with a small cover added to his clothes. But if the central heat, yes, it is cold, then you have to put gloves and socks.
Thank you. Dr. Rouba is not audible. Okay.
Yes.
Thank you, doctor, for that.
Yes.
Now I'd like Ms. Sakina to answer a few of the questions as she already have conveyed to us. But a quick remedy: how do I manage weight gain during pregnancy? Though it is normal to gain weight during pregnancies, around 10 to 12 kgs, if I'm not wrong, Dr. Shamim can correct me as well.
True.
It's quite
Yes.
fine to add, but still people are worried. Women are worried during pregnancies. So what is the advice for them?
Can you just repeat the questions? Weight gain, or
How
they want
to manage weight gain during pregnancy?
Okay, they want to control the gain.
Weight.
Okay. No, so like I told you, make sure that you are keeping half your plate vegetables. That will ensure that you're not overeating. Keep your meals small and frequent. So there has to be 3 main meals, and there should be 2 small snacks in between, so that you don't overeat at the subsequent meal. So make sure you do that, and that will ensure that you're getting the right kind of nutrients in the right portions, and you're not getting anything excess.
Absolutely. Can I eat packaged salad during pregnancy?
No, it is not advised to take anything that is cut beforehand, because you don't know how was it cut and how was it cleaned and how long was it packed before. So it is advisable, if you're taking anything raw fruits or raw vegetables, it has to be cut fresh by yourself before having it.
Most important recommended vegetables you can share with our audience as far as they are receiving, vitamin D, folic acid, and iron through them.
Okay. Beetroot is very good. Carrots are very good. When it comes to vegetables, there's no vegetables that you can omit. So you have to make sure that over the whole week you are trying to get a rainbow of all the colors. So yellow, red, green, purple. Make sure that throughout the week you are getting each of those colors. So when you aim that, you will get all the nutrients in proper proportion.
Thank you, Ms. Sakina, for that. Now, very important question, which I believe that we should, all the 3 parameters: gynecology, then neonatology or pediatrics, and the dietetics is the diabetes. So, Dr. Shamim, I would like to start with you first. Once you confirm the diabetes, during pregnancy, and you feel that patient is having high blood sugar levels, what is the journey of the patient from there? And then we will ask the same question to Dr. Rouba, wherein we would like to know the gestational diabetic and children and the risk in the future. And then I would like to know from Ms. Sakina, what is the advice for them, and how do we follow up that way? So over to Dr. Shamim first.
Well, a small question, but it really needs an elaborate answer. There is diabetes, there is gestational diabetes. If a patient is diabetic, she'll be diabetic from the beginning of pregnancy when we do a fasting sugar. For such patients, we don't go for GTT, glucose tolerance test. We don't give them glucose. If the sugar levels are high, we put them on diet. And thereafter, after giving them diet, after a week, 10 days, we give them a chart and ask them to do their blood sugars. And we write their levels. If the sugars are well controlled, they go on with their diet. If the sugars are not controlled, then we refer them to the endocrinologist. He will be adding oral hypoglycemics. And if after that they are controlled, they go on like that till term. But now, if even with those it's not controlled, then we add on to the insulin. Now, what is gestational diabetes? Gestational diabetes is which we see first time during pregnancy between 24 to 28 weeks. So when there's a gestational diabetes, again, if the sugar levels are in borderline high, as I mentioned earlier, put them on diet, repeat their sugars in about a week's time, and if they are well controlled, let them continue on the same diet till the end, till they deliver. But if they are not controlled, same thing will follow, add oral hyperglycemics, add insulin, control sugars. But sometimes it happens after doing everything, sugars are not controlled. We somehow carry them on till 37 weeks and deliver them. And diabetes has effect upon the baby as well as upon the mother later on. So I'll just would like Dr. Rouba to say whatever about the neonatology of the baby,
Thank you very much.
Baby is delivered. Yeah, Dr. Rouba.
Thankfully, actually, in our prime, rarely we are seeing complication because most of the mother are controlled. But of course, the risk is more when the mother does not have controlled diabetes. All babies for diabetes mother has to be fully examined, and their blood sugar should be monitored till 24 hours because they are at higher risk of low blood sugar. Even their calcium might go low. So if they got jitterness, immediately we need to check both sugar and calcium. If we are not able to maintain baby blood sugar more than 40 in spite of feeding, then they have to be transferred to the incubator and given glucose by IV line. Because sugar is very important for brain growth and development. Until now, we don't know how much the level which can affect brain injury. That's why we are keen to maintain blood glucose more than 40. And the baby who are born for mother uncontrolled diabetes, they are at risk for anomalies, heart anomalies, colon anomalies. That's why they need thorough examination and follow them, and they should pass a stool in the first day also.
Thank you, Doctor. Over to Ms. Sakina. Now, both the roles. One is during the pregnancy, diabetes, and after the pregnancy, how do you guide them for diet and lifestyle modifications?
Okay. Hi. So during the pregnancy, it is very, very important to get the sugars within control, or else it can have effects on the baby. So we usually aim to make sure that the patient is having healthy meal plates, similar to what I explained, and more. But they need to make sure they focus more on vegetables, on low glycemic index carbs, so to make sure that their fiber intake is very high, so the sugar is quite well controlled. We also focus on a lot of healthy fats and protein, so that the sugars are well controlled. We go a little low on carb if the sugars are not controlled, and as well I especially recommend monitoring the sugar levels postprandial after eating their food, so we can get an idea of how the sugars are reacting to the food that is taken, and accordingly we can make food combinations and manipulations in the diet to get the sugars as close to normal as possible, so that they don't need to start medications or increase the doses of medications in the future. And for lactation, similarly, we cannot cut down on the calories so much. We have to make sure that the mother is eating well, so that it does not affect her milk production as well. But it has to be on a very healthy line, similar high fiber, low glycemic index, carbohydrates, complex carbs, to make sure that the sugars is well within the normal range.
Okay. Thank you. Thank you, Ms. Sakina, for that elaborative answer. As we are proceeding, now we have some questions in the comment section. Ms. Aisha is asking, is the tetanus vaccine or any other vaccine required during pregnancy? I think Dr. Shamim has elaborated that, but a quick one, Dr. Shamim, from you.
To 32 weeks. Previously, we were not, but now very much recommended, and it's offered to the patients, and we give it between that gestation.
Thank you, Doctor, for that answer. As we are proceeding towards end of the session, and we know that we are living in the era of COVID times. And I would like to end up the session with, since 2020 till 2021, this has been really a tough journey, but we are trying to conquer it now. The vaccine is there. Dr. Shamim, we would like to, end up the session from all the speakers to know, take home message, and also how you felt that, women who were coming to you with delivery and at the same time pandemic issue, is that, mental health and well-being, how it is going, what is the direction towards, how you're handling the situation, and how you're really counseling mothers, because the fear is there that more than being mother, it is for the, children, or more than mother, it's for the baby who's going to come to this world. How do you really cope up with such situation on day-to-day basis in current times?
To be honest with you, in the beginning of the COVID, it was a difficult situation. We didn't really know how to handle and how to go around. But slowly, everything has got settled. When we see so many patients nowadays who have been COVID positive, firstly, we have to make sure we counsel the patient that baby is not going to get affected by any means. The only risk is if the COVID is attacking a pregnant lady, their immunity is already low, so they may go into a preterm delivery. So the baby may have problems because of the preterm, not because of the COVID itself. So we do counsel these mothers once they are COVID positive. Now it's made so easy. 10 days isolation, and after 10 days, when they become asymptomatic, they can come for their routine checkup and take precautions for COVID as it is for anyone else. With precautions, they come back to us. But if they are symptomatic, then we do their counseling on the phone and follow them on phone as well. And it's become more better, as I mentioned, that now even the vaccinations are allowed. We can give vaccination to pregnant ladies. And we have kept one area in our labor room, which is just for the COVID patients. So that way things have really eased out, and it's much better now organized, that even we are receiving COVID patients, we deliver them, we follow them. Normally we call any patient who delivers, we call them after 5 days. But for the COVID patients, we tell them, come after 10 days if we have come to know that they are COVID positive. But they come for follow-up.
And what's your take-home message for all the lovely pregnant ladies?
My take-back message is that please don't be frightened even if you get COVID. I'm sure after some time it will be taken like as any viral infection. So don't worry, just take plenty of fluids. Keep in touch with the doctor. If you have a fever, take paracetamol, but a proper dose, not 500 milligrams, at least 1 gram. And don't worry how your baby is not going to get affected by your COVID. Take care of yourself. Inshallah, baby will also come out.
Thank you for that lovely message, Dr. Shamim. And I would like to request Dr. Rouba as well to tell us something during this current, scenario, her experience in very brief, which can enlighten our parents, and any specific message they should follow and take home message as well.
Dr. Shamim had already given all the advice. Actually, as she said, we were all confused at the beginning. Now all COVID mother, they are kept in separate department and their baby with them. Before we were separating baby from mother. Now baby should share mother room and mother can proceed feeding. but she has to follow the hand hygiene and wear mask. Baby before discharge, we do swab, COVID swab for baby, and most of the cases, or actually all cases, it came negative. And if partner is negative, so baby can come to us for follow-up as normal visit as we recommended. In case a partner is positive and no one can bring the baby, we can assure ourselves babies into parents after 2 days, so be sure that the baby does not have any issue, because he is also at risk of having jaundice. If baby has by any chance COVID positive, then we'll give them the instruction what to monitor, their breathing and their temperature. If everything is settled, the baby will be with mother side, and after 10 days they come. If baby have to start some symptoms, they can call the hotline DHA to manage their baby. So as a whole, we have to tell mother, be relax. If you are COVID positive, your baby is fine. Continue breastfeeding because that will help baby immunity. And we will see you after 10 days, both you and your baby, and give you further help if you need.
Thank you, Dr. Rouba. Now, finally, Ms. Sakina, because diet is very close to everybody's heart. So very important take-home message for all the beautiful ladies and their families.
I just like to say in very brief that make sure that you eat healthy and stay well hydrated. That is very, very important. And take your multivitamins on time. Don't skip on them, so that will bridge the gap between your diet and the requirements and help your immune system and boost your immune system. And of course, stay safe.
Okay, that was quite excellent. Now, I would like to thank all my speakers for their speeches, and it really increases my knowledge. I hope that it will play a major role in the pregnant ladies. Thank you for and to all the lovely audience who have been with us since this whole 1 hour. Thank you for attending our webinar, Healthy Pregnancy and Beyond. We hope you enjoyed it. If you have any questions which was not answered during the session, we plan to get back to you within the next 2 to 3 days. We will share the links with you. You can also access these slides and recordings through our Prime Health Facebook, LinkedIn, or YouTube, or you can write to us at primehealth.ae. We are there to answer all your queries as we have done before. Do not forget that health comes first. Take ownership of it. Stay healthy and stay blessed. Thank you.